Adancor, a proven therapy that mimics a natural process of ischemic preconditioning that protects the heart from subsequent ischemic attacks. Ischemic heart disease, at the origin of most stable coronary artery diseases, is the leading cause of death in the world. As a treatment, Adancor utilizes nicorandil as its principal compound and has a dual mode of action. It's a nitric oxide donor as well as a potassium channel opener. As a nitric oxide donor, Adancor provides hemodynamic benefits by promoting vasodilation of systemic veins and epicardial coronaries, thus reducing preload and increasing coronary blood flow. Whereas as a potassium channel opener, Adancor opens adenosine triphosphate-dependent potassium channels at 2 levels. At the level of vascular smooth muscle of coronary arteries and arterioles with atheromatous plaques and stenosis, Adancor acts by opening potassium channels on the vascular smooth muscle membrane. This involves potassium efflux and consequent membrane hyperpolarization, leading to the closure of calcium channels. Thus, blood vessels are dilated and the resistance to blood flow through the arterial system is reduced, which decreases afterload. At the level of mitochondria in cardiac myocytes, Adancor develops a cardioprotective effect by inducing ischemic preconditioning. Adancor acts by opening potassium channels in the mitochondrial wall, allowing potassium influx. This implies the closure of calcium channels and the subsequent decrease of calcium toxic overload caused by ischemia injury. The normal ATP production is now restored. Therefore, Adancor's effect of mimicking ischemic preconditioning reduces the rate of cell death, the infarction size, and myocardial necrosis. According to clinical data, Adancor relieves symptoms and promotes prognosis. Specifically, it significantly reduces the number of both weekly angina attacks and nitroglycerin consumption by 50%. Furthermore, in the prospective Iona Impact of Nicorandil in Angina study, conducted over a mean of 1.5 years, all cardiovascular events were reduced by 14%. Thus, Adancor is a treatment that addresses the main unmet needs in treating myocardial ischemia. It reduces major cardiovascular events, has proven anti-anginal benefits as well as benefits versus nitrates, helps to avoid hypotension and brachycardia, is excellent for safety and tolerability, benefits microvascular angina, and is cost-effective. Adancor with nicorandil as its principal ingredient will play an important role as a therapy for patients with coronary heart disease, in addition to its proven effectiveness in reducing symptoms.